And as we're seeing those cooler temperatures, doctors are warning residents of a surge of seasonal viruses that are increasing, and some even have the ability to be fatal in some cases. Now our KAGS Andrea Uribe spoke with local doctors about the warning signs to watch out for.
Flu and COVID cases are at an all-time high in Brazos Valley during this time of year. I am here at Baylor Scott & White Medical Center to speak to Dr. Rayburn about what people's best options are.
We're experiencing quite a surge in respiratory viral illnesses right now, much like most hospitals across the United States. It's a combination of COVID that is endemic, meaning it's here and we're living with it, and a pretty significant surge in influenza as well as respiratory syncytial virus. I'll refer to it as RSV.
Dr. William Rayburn explains why flu and COVID numbers have been skyrocketing and creating this surge in the Brazos Valley.
During the pandemic, we literally spread people out. We closed schools, we closed restaurants and bars, we shut down, and it resulted in now a number of people that have not been exposed to flu, not been exposed to RSV.
The pandemic made residents more vulnerable to contracting flu or COVID, and if you have underlying health conditions, these viruses can become fatal.
If you have concomitant or comorbid conditions such as heart disease or diabetes or kidney disease, significant obesity, respiratory conditions, then the flu illness as well as the COVID can be more severe.
Rayburn describes the options that residents have in the Brazos Valley.
There are options to get diagnosed. There are options to receive treatment outside of the traditional urgent care emergency room visit, not to mention the expense associated with those two.
Another option for residents is to download the Baylor Scott & White app and have a virtual consultation. Andrea Uribe, KAGS News.
And you don't even have to be a patient at Baylor Scott & White to download and use this app, but doctors recommend seeking other options before immediately going to their emergency room.